Hello, welcome back to the Aligned Strength Podcast. I'm your host, Mandy Scow, and today I am joined by Dr. Tommy Rhee. He is president and CEO chiropractor and an author of The Future of Regenerative Medicine. Dr. Rhee has worked with countless individuals from everyday people to elite athletes, even some professional athletes and professional teams. So he has hands-on experience with both clinical and athletics settings, giving him a unique perspective on performance, recovery, and long-term health. Welcome, Dr. Rhee.
How are you doing, Manny? Thank you very much for this. This is going to be a great talk.
Yeah. So let's talk about your book. You have a book on regenerative medicine. So someone who may not know anything about that, give us a little bit of background on regenerative medicine and what your book is about.
All right. So the book, The Future of Regenerative Medicine, everybody knows the word stem cell therapy, regenerative medicine, and it's all about healing. And the problem is that if you really look at the mechanism, people don't understand that. They think that you take this cell, and that cell, if you introduce it into your body, will turn into that cell that has to be repaired or regenerated. Well, that's not what it doesn't do that. It signals. So because of that, that common question that kept on coming up, especially when I developed that topical stem cell cream, RheeGen. The big thing was that how to explain it over and over again in a, like a polite manner. And I say, hey, write a book about it. So that's why I wrote the book. The book really explains what, different kind of stem cells. We have our own adult stem cells, and we have it at other places. And then why do we obtain those cells, and what do they really do to our existing cell? And the book really talks through the science side of it. And there's also a layman's point of view, which is Jeff's journey into discovering stem cell, different kind of stem cells, and then where it's at the present time, and where the future is going to be in regenerative medicine or stem cell therapy.
Okay. And with that, how do you use that on your patients? Because you work in like chiropractic care, correct?
Yeah. So chiropractic. So we're in the best environment because chiropractic is about innate intelligence. We want the body to do its own healing by, so when you look at like chiropractic and the spine, you get the low back, the neck, and cervical and all that stuff. So there's a big, the central nervous system, and they kind of branch out these nerves. Well, like a garden hose, if you pinch off the garden hose, you decrease that kind of communication from the central nervous system to that peripheral or that organ. So you have to free everything up. So we allow, in the chiropractor, we allow the freeing up of all these obstructions to get a good, better ability to heal, do its proper kind of function in the body. So then you take the next step, which, all right, why do we slow down our healing process? Well, we have to figure out what's going on. So in the chiropractic world, we believe in our own body doing its own ability, but we just need to introduce information, signals to say, all right, do your job, decrease obstruction or increase the signaling. One of those things have to do. That's what chiropractic is, a great avenue go into it. So when I see my patients that are great candidates for these things, and they're going down a pathway of like, the orthopedic surgeon will say, well, knee replacement or some type of like, pharmaceutical world of like NSAIDs or something heavy in the anti-inflammatory world or something. Well, your body can do these things. You just have to get the right information to allow it to do those things. So that's why it was a really easy transition from chiropractic, and then into the world of regenerative medicine.
Okay. And how would you say, like, how does this work with injuries? If we're talking about like the sports and athletes, or like I own a gym, so we are lifting and that kind of. Is there any injuries that this is best for?
Okay, so let's talk about the professional athlete. The professional athlete, it's about time and recovery. You want to speed up the healing process so they can get back on the field either by, practicing, working out, or playing a game. And their worth is as much as that time on the field. So you want to recover fast you can. So more information, the better your body will heal faster, right? So like if we're 15 years old versus when we're like 35 years old, 15 years old, you heal real fast because you have those adult stem cells that are really activating and really able to do things. It has the right signals in there. As we age, those signals decrease and our body doesn't have that ability to heal, regenerate fast as we're 15 years old. So then you transition into the weekend warriors or people like my age. I'm 50 plus, right?
Mhm.
So I love working out. I love physical activity. The problem is that we don't have that great ability to recover fast, like one day, half a day, and I can get back into the gym. It takes days for me to do it. So I need to
Mhm.
speed up the healing process. So I need the information, the signals to go to the existing tissue and say, hey, wake up, turn on, regenerate, and get better so they can go back in the gym or that run. So that's why that moves into from the athlete into the weekend warriors and the people like me in that physical activity that wants to continue on being physical at this age and plus.
Mhm. Mhm. Can you any specific like teams or athletes that you can mention that you have worked with? Because you're in the Tampa Bay area, right?
Yeah.
So who or what teams have you specifically worked with like some of their athletes?
Well, see, now it, my history goes back all the way from UCLA. So I used to be the chiropractor for UCLA with the athletic department with the track and field, football, soccer, all that stuff. Then as they graduated or they go into the professional world, they would call me in for consulting or working on them, and then they would move me into these other kind of like these teams or this part of the
Mhm.
country where they are actually playing. So then when I moved from California to Florida, I was a part of a couple athletes out there as far as the tennis world, WWE, as far as the wrestling, and then I was a team doctor for the Tampa Bay Buccaneers between 2015 2018.
Mhm.
And then after I sensed that, I'm getting to that point where I'm not young anymore. Traveling is tough on me. So I'm
Mhm.
trying to transition from the athletic side of taking care of people to the overall patient, the bigger pool of people that I could reach out more. And that's
Mhm.
why I feel more comfortable moving in since I have the experience from all these kind of like these avenues of like, levels of sports. Now I can apply that to like normal people, how to heal faster, how to prevent injuries in a larger scale with stem cell or regenerative medicine.
Mhm. What is some advice that you could give athletes or even let's just say even like high schoolers, college athletes to prevent injury? Is there anything that you do in your practice that can help prevent injury?
Okay, generically speaking, for athletes that are looking to get to the next level, you have to be careful about overtraining. Overtraining is deadly. It's one of the worst things because it's not just physical, it's mental that you'll really get, you know,
Mhm.
degrading in. So I see a lot of athletes that are like machines, like they are workout like phenoms. They will work out, but they don't understand the second side of that, right? The other side of that, which is the recovery. You need your body to recover. So I have to
Mhm.
explain to them gently as possible that when you break down muscle tissue, you want that ability to recover, to heal, so then you have a stronger, bigger muscle, and then you continue that, break it down, build, break it down, build. The problem is when you overtrain, you're just breaking down where you don't have the recovery, and then now your performance decreases a lot. Now the
Mhm.
mental side, now you're guessing, goes, it can't be my workouts because I work out so much. It must be my coach. It must be the way I'm working out. Now you're changing your technique. Now you're doing a lot of things that you shouldn't have done in the first place because it's all about giving your body to recover. So that's the
Mhm.
biggest thing that I would recommend all athletes when they're starting off or understanding about working out, recovery. And it doesn't matter what type of recovery it is. It could be a mental recovery, physical. You got to get involved with it. And then all the tools that are necessary to get those recoveries, that's important.
Yes, absolutely. Do you have a lot of clients that are on that continuously come to you like on a maintenance type plan as they're training just to keep, is that part of your or their like plan for injury prevention as well, would you
Yeah,
say? Like,
I used to be that. So because I'm transitioning away from like like patient care and more into the actual like the development and the formulation, all that stuff for the topical and the book and these things. It's I'm slowly transitioning now, but I really specialize in like those unique cases that people like. You go and you're seeing let's say a knee issue at a physical therapist or a chiropractor, and it's not getting better. Well, I'm that guy. I'm that guy that gives you the second, third opinion before they say, all right, let's go into your knee and do a PCL, ACL, or some type of reconstruction. Well, you want to see me. I like those special cases. So another one is a special case is post-op where you basically reconstruct the knee, but it doesn't feel normal. Something's going on still, right? Well,
Mhm.
now that's more interesting because now you change your anatomy. Now it's not where it should be. It's anchored somewhere else. So you come see me and we adjust to what you have now because of the post-op world, and then we adjust from that. So that's the kind of stuff that I do.
Okay. Okay. I can tell you a little bit about my son and what you think about this because he's had in eighth grade, he's now a sophomore, and he's 16, but 2 years ago, um, in Fayed at school, he went to kick a kickball as hard as he could and he heard a pop. So there was an avulsion fracture in his pelvic area, like hip flexor area, right? So his quad muscle like pulled his bone away. Um, did the healing process with that. We did some laser therapy, chiropractic therapy, and lots of rest, like 7.5 weeks of rest. It was healed. We had x rays that showed it was healed. And then this past fall in football, um, he was asked to kick, and he knew he probably shouldn't kick the football for like a kicker. He's not a kicker, but same thing happened again, and his bone pulled away. He knew it right away, uh, and he's healed now. But we took CT scan, and it was it was a lot of rest, but it was. I mean, and the doctor said that they've seen it, but they've never seen it happen twice. And so
Are you yeah, there you are. Oh yeah.
yeah,
Okay.
yeah. That it never happened. They've never seen this doctor has never seen it happen twice, but seen it happen to kids and right in the growth plate area. Like for that, like what would you suggest? Anything specific? Like in our mind, we're like he can't kick. He's not a soccer player. He plays baseball mainly and football, but he can't kick, and he just needs to be careful. Do you think like is this something that maybe will get better as he after he's done growing, or is this something they're
Yeah.
just seeing the muscle pull it away, the bone away, and then it comes back together and but
Yeah,
thoughts.
so the big thing is that when a child grows real fast, those growth plates are basically the bones having fused, right? And the
Yeah.
worst places are where the attachment, where the tendon attaches to the bone. So the avulsion fracture is exactly what you're saying. So the bone pulls off, and
Hmm.
then you got this kind of like this fragment up there. So you hear things like Osgood Schlatters for the knee. In your case, your son's off this muscle called the rectus femoris, off the AIIS, kind of like the junction there.
Hmm.
So when you see these things and then you're trying to prevent it, the tough thing is that you look at the belly muscle. So he has very developed muscles, it sounds like, right? So
Hmm.
the problem is that his muscles are more stronger than the connection or where the growth place is, trying to fuse together, but
Yeah.
you don't want to really diffuse yet because he's still growing. So it's kind of like catch 22. In my case, to recommend to your son, I would start thinking about doing some yoga, stretching out, stretching the
Okay.
belly, the muscle, not so much the whole kind of origin search, but get the belly, the muscle stretch because it's
Hmm.
very taut. So think about a bone. When the bone grows real fast, it outgrows a muscle, and then the muscle catches up. So as he's an active person trying to kick, it has a shorter pathway because it's too tight. So it does is like he's trying to pull his leg in an extension to get ready for a kick, and he snaps it forward. That's the weakest point at the very end range of things. That's where injuries occur for those type of fractures.
Hmm. Yep. And that all makes, I mean, that makes sense to, with everything with that too. So, good. Thank you for that information.
Yeah.
Um, so there's a lot of confusion possibly like about pain and aging and injury recovery. What are some of the biggest myths you see people believing with that kind of stuff?
Well, that's a big question. So pain by itself is a good signal. So you have to be able to listen to your body. Listen to your body and don't mask it. You don't want to do things like for instance, like when I'm in pain and I have to do some type of like activity and I have to push through pain and it's a mandatory thing, then maybe you can do like if you have to go in that world, like if you're a professional athlete or you're something that you need to go through pain. Well, I can see then you're in that pain med world where you're doing like some type of narcotic or something. I get that part. But when you're just like a weekend warrior like myself and you're in pain, you have to listen to your body. It says, why did this occur? Is it overuse? Is it lack of recovery? Am I doing too much? Or is it poor biomechanics? So you have to break it down. You want to go find a good sports guy like myself out there and really like tune into him. Don't go to like a guy that says I'm a family sports, personal injury, and has a lot of like, like a lot of, how would you say, specialties in there. You want to go to someone that looks like they're athletic themselves, and you look at their facilities athletic, and then they can really go into your world because you're an athletic person and you want to stay active. He will give you the right instructions how to continue on and then reduce the pain. So the big thing of pain is that it's a signaler. So you have to figure out what's going on. Then the next thing you got to do is more than likely it's about recovery. You've got to understand, as we get older, we age. So our body has the ability to regenerate no matter what, like, when we're 12 to 10, every 30, 90, 100 days, our cells recycle. The problem is as we get older, that cycle gets longer and longer because our adult stem cells that we have in our body decrease. They go into like a zombie state or like they kind of get sleepy. And you have to figure out why is that. Then you go down to the biology. So when you look at the biology, it's all about what they think about, like remember on those days of biology, we took a nap it was during the subject of mitosis, cell division.
Yep.
Well, that's what's important here. You got to figure out what is going on. Why is our cells not what they call replicating from RNA, DNA, making these daughter cells and dividing? Well, you have to go down to the next level, which is the actual chromosomes. At the end of the chromosomes are things called telomeres. Telomeres are those little safety mechanisms, just like on the end of a shoestring, right? The little plastic cap. Well, as we replicate and we cell divide, we only have so many of these things called Hayflick limit. So when we replicate and we start going into the later stage of it, well, we don't want these little codes, these ATCGs to miss, because if we miss the codes, it'll turn into from a hair follicle to maybe something else that it coded for something else, right? So we don't want a tumor formation or something. So these end caps are protecting it. So if we lose that end cap, we won't have that misfiring of coding. Well, because of that, it doesn't cell divide. So it goes into a thing called senescence, a zombie state. So these adult stem cells kind of go sleep. Well, you need something to wake it up. These enzyme called telomerase is what that enzyme increased telomeres. Now, where is those telomerase enzyme? We have in our body, but again, as we age, they decrease, and they kind of they get stored in different places. But what's really neat about the stem cell or regenerative medicine is there's information signals out there that you can basically bring into your body to say, hey, increase telomeres, get out of senescence, zombie state, start regenerating, start working. So there's a great pathway. So when it comes to start with pain, indicating what's going on, then you look at why can't I regenerate? Then you need to do something to get yourself out of that senescent state. And then finally, you're looking at staying active. You always have to stay active no matter what it is. Just stay active. It's the most important thing. And everybody knows from musculoskeletal world to organ function to brain function, you need movement. It's all about movement. So that's the biggest thing. So I that's why I love this course of action I'm taking right now, which is just getting people understanding their body and getting the right tools in their hands so they can keep going to that, pushing that 110 years old age.
Yeah. Yes. Do you have tools that you like use in your chiropractic office to help with all of this?
Yeah. So besides what I have for the topical stem cell cream, we know RheeGen, right? But as far as equipment in my office, we have like hyperbaric chambers. We have these things called shockwave. We have it's called piezo wave, and that thing really utilizes sound wave, and it helps push out inflammatory response in a certain part of your body that we can't get to. So it helps pushes it out. Then we have things like e-stem, ultrasound, the classic stuff you see in the physio office. We have a thing called Takar. Takar is a radio diathermy frequency type of device that uses its ability to excite the tissue deep in the joint or the body, and it creates heat within that tissue instead of we from the outside bringing heat inside. And then we have class 4 laser. We've got the 60 watts. That excites the nitric oxide and speeds up the ATP production in the mitochondria. And then we have this. We like to find out. Diagnosing is the most important thing. Either it's from X-rays, MRIs, ultrasound, and then we also use this device. It's an ANS system that looks at risk factors. Your ANS is your autonomic nervous system, and we can determine based on how you respond to orthostatic movement if you have a high risk for cardiovascular disease or diabetes or some type of neuropathy. So there's a whole bunch of things that we have in our office, and that's why we really like to hone in that specialty cases.
Yes. Yep, understand. And with that, would you say some of your clients, have you been able to avoid surgeries with them by using like your equipment, your tools, and have you had a lot of cases where you've been able to, um, uh, like treat them without having them needing to go to the surgery route?
Yeah, 100%. It's
Mhm.
rotator cuff. There are rotator cuff that you're going to have a partial tear out there, tear thickness. So you're going to have the tear. The thing is that if you look at the post-op procedures and the time frame, and then you look at the other side, which is the basically home therapy or come to my office and do therapy, it's even shorter if you just know what to do. You just got to find someone like me to kind of guide you along, to know what muscles you can activate and when you want to slow down to the healing is concluded, and then you go in and go ahead and tax that tissue. So yeah, absolutely. I've got from rotator cuff, classic, lumbars, knees. When you have a full thickness tear, it's kind of like you can possibly do it, but if you have a complete rupture of a tendon or a ligament, that's tough. I mean, now you're looking at a surgical route where I can't grab it and reattach it
Yeah.
back. You need that attachment back on there. But there's some muscles that if you did tear it, it's okay. You still have like maybe 30 or 50% of them fibers left, and
Mhm.
it's gonna insert somewhere else. So as far as like surgical um, world that we avoid, yeah, absolutely, we have got some patients like that.
Good, good. And what would someone like ask themselves before committing to a surgery option? Like, go ahead.
Yeah, second opinion. Go for a second opinion. You'll know, like if you go and you hear a pop in your knee, but you have a swelling, but you're able to walk, you're able to do things, but then you go to get your MRI and you have that ACL tear, and then the ortho says, hey, let's do surgery, and then they'll talk about either a cadaver or your own tissue. They have to do a little bit of grafting and all that, and then your recovery time is 6 to 12 months. And you're like, whoa, that's a long time, but you're able to walk right now. So when you kind of feel that, you want to get a second opinion. Go find someone that specializes in sports. They're really good at it. It's biomechanics. So either again, find
Mhm.
someone that if you look at their website, if you look at their facility, and it looks like a training room, like a team environment, like you go in there, and goes, whoa, it looks like a locker room or a fitness center or something. Now you're on the right course. Then you're in it. If you go down to a chiropractic or a physical therapy office and it doesn't look like an active place to be. Then you have to ask yourself, well, this doesn't really match the description of what I have. They're probably good at maybe the simple things like post-op recovery, reduces swelling, and get them back to a normal world. But if you want to go into an active world, you want to find someone active in that provider life.
Yes, absolutely. So, for our listeners who want to improve mobility, energy, and longevity starting today, what are three simple things they can do right now?
Right now, easy thing is walk. Pick a step. Pick 5,000, 7,000. Pick a number and go for it. 20 minutes. There are guys out there that are very fit and they still walk. They put that in their daily routine. And the neat thing about that is they'll do 20-minute walks 3 times a day.
Mhm.
Breakfast, lunch, dinner. Just walk. And the really important thing is that you look at the output. So that's your output. You want to use your energy, your exercise mode, but you have to also watch the input, food intake. Just look at what you're eating. I'm the worst case scenario. I'm very good at output. I'm very good at exercise, but my intake, I need to work on that. So it's one of those things that I know I need to tune up. But um, food, exercise, and then if you're a beginner, steps. Use
Mhm.
your body, do aerobics, something that allows you to get your heart rate up there, and find a good trainer, find a good coach and a good team that you can support, because
Mhm.
you have to look at your body as an investment. And that investment is like, I would look at yourself, like I look at my athletes, like a race car. When you look at a race car, they have a team, the team mechanics. You have everybody that can support that car to do its best during a race. Well, if you're that person that's active, well, you're that race car, and you got to find that type of team to support your car to go further and faster. So
Mhm.
those are the big things that I see, just activity and intake. And then the last thing is that I'm into, I'm in my faith. So faith, meditation, anything you can have to tune in, because if you're stressed out physically, I mean mentally, you have to bring it down. And the way I bring it down for my mental stress is physical. I bring up the physical up. So at that time, you become one, and then you go into like a state of euphoria, and then that's when you meditate. That's when you really tune into your body, listen to your heart rate, listen to the flow of the blood going out and into the heart, lungs, and then go to your fate. So those
Yeah.
are the things I look at.
Yes, absolutely. I mean, I agree 100%. I try and tell people like just start with moving your body. Just move your body and find something you enjoy, because when you find something you enjoy that is active, you're going to keep doing it, right? Um yes, wonderful. So, where can we get, or our listeners find your book, The Future of Regenerative Medicine? If they're looking for the book, where can they find that? And I'll include links and stuff too in the show notes of the podcast. So, but tell us where they can find that.
Yeah, you can find my book, The Future of Regenerative Medicine, on Amazon. And all you got to do is just on the search bar, The Future of Regenerative Medicine, and then just space Dr. Rhee, Rhee, and it should pop up right away. And then, of course, there's the audio, and then the ebook, and the paperback and hardback. And then
Excellent.
if you want to get a hold of me personally, you can go on RheeGen.com, RheeGen.com, and then go to the info and then click on that and then send your message and I'll answer your questions.
Awesome. Well, thank you so much, Dr. Rhee, for joining us today. And yeah, if I thought this was some excellent information for people to hear, and I will put all of your information in the show notes at the bottom of the podcast. So, yes, it was great meeting you, and thank you all for listening today.
Thank you very much. I had a great time, Andy. This is great.
Good. All right. Thank you.